Hello and welcome. I'm Dr. Valerie Cacho, and today I will be presenting about sleep apnea and COPD. Thanks so much for joining. Just a little bit about me. I'm a mother, a daughter, a student. I consider myself a lifelong learner, educator, physician, and healer. I have done a couple different training programs. I'm trained in internal medicine, sleep medicine, as well as integrative medicine. And currently, I'm the founder and president of Sleep Life Med, which is an integrative telesleep medicine practice for residents of Hawaii and California. I really love talking about sleep and teaching my community about the importance of it and its importance for wellness. I also have a very special interest in women's sleep. Also, I've been practicing medicine for over 10 years. So just a disclaimer, the information provided here is really for educational purposes alone. If something comes up from it, please talk to your doctor or licensed health professional about your concerns. Let's get started. So what is sleep? Have you ever thought about what actually happens in your body or your brain when you do fall asleep at night? I like to break it down pretty simple in 3 different steps. If I brought you to the lab and I put little leads on your heads called EEG, what we're looking for is a characteristic pattern of how fast or how slow your brain waves are going. So at sleep onset, we're looking for theta waves, and it just represents the brain waves slowing down. Another aspect of sleep is when our muscles relax, right? Our brain waves slow down and our muscles relax, right? We don't need to be moving when we're asleep. Some people do move when they're asleep, and that can be normal, or it can be an underlying sleep condition. And then we lose consciousness. We're not aware of really what's going on when we're asleep. During our dream state, we can actually remember some of our dreams, depending on the timing of a dream to when we wake up. But typically we lose consciousness and we're not completely aware of what's happening when we're sleeping. The importance of sleep. There's one thing that you hear from my lecture today, or one thing that you remember, is that sleep is really vital for overall health. Our culture is a little bit of a hustle culture. I'll sleep when I'm dead, or I'll sleep when I'm retired. But sleep is as vital as drinking water, as getting sunshine, and as moving your body. Without it, it really leaves a lot of difficult medical conditions, or just it can be really difficult for us to function properly without an adequate amount of sleep. So let's talk about our heart health, right? If you don't sleep at least 6 hours a night, it has been associated with higher blood pressure. Additionally, sleep is really important for our brain health, our cognition. So the way that we think about things, our logical decision making, and even our memory. So during sleep, there's actually a part of the night called our deep sleep, or stage 3 sleep. It's when our brains, I like to call them trash collectors, come up to clean up the waste that's built up through the day. I know some of the researchers and sleep scientists talk about it's the shampooing effect that happens at night, just to clean your brain from the dirt. So your brain actually does get clean when you sleep. It's a restorative phase of the day, and it's really, really important. And also our metabolism. So this is really interesting. They've actually slept deprived college students, and they've also studied, folks like nurses who work night shift. And what they found is when we don't get an adequate amount of sleep, we actually tend to crave junk food. So this is when we get an adequate amount of sleep, we crave junk food less. So typically it's like 6 hours or less. There's a hormone called ghrelin. Think of ghrelin like a gremlin, makes you want to eat more. So ghrelin goes up without an adequate amount of sleep, and then leptin goes down. So leptin puts the brake on our appetite. So, right, nurses who work overnight tend to sleep less. Slept deprived college students, and they tend to eat more of the simple carbohydrate foods, the junk food, because the body says I need energy. But really, it doesn't need food, it needs sleep. So moving on to talk about obstructive sleep apnea. What is obstructive sleep apnea? I call it OSA. Sometimes we just shorthand it. And it's a physical blockage that happens in your upper airway only during sleep. So to break it down here, it's an obstruction. If you take a look at this diagram here, this represents the normal breathing pattern. And then there's snoring and then OSA. So imagine I cut your body in half. We're taking a side view picture here, eyes, nose, and mouth. The blue arrow represents the air and the oxygen flowing down into the body. In the snoring picture, what you can see here is that there's partial collapse of the airway. Typically, the tongue is the culprit, but also if you had a crooked nose or if you had problems with nasal allergies or enlarged turbinates, that can lead to decreased air flowing down into your body as well. So I like to, when I talk to my patients and I give talks, snoring is like whistling, right? At night when you sleep, right, your brainwaves slow down, your muscles relax. And so if your airway relaxes to the point where air goes through, it makes a noise, and that's snoring, which typically for most patients, it's not problematic until it's a problem for their bed partner. Some people do wake up because they catch themselves snoring, and some people just have no idea that they do it. And then really what's problematic is the OSA part, and it's complete or even partial obstruction of the airway. Just imagine, right, your airway narrowing to the point where it's so tight, air has a hard time going through. And that's represented by the blue arrows. So no air means no oxygen, which can lead to a lot of havoc within our body, our brains. Basically every cell in our organ, in our body, all the cells need oxygen. It's their food. And so OSA, right, it's a physical blockage of the airway. Typically, it's the tongue falling back. But also, if you have a large BMI, if your neck circumference for men is above 17 inches and for females above 16 inches, that extra fat can push on the airway, leading to some obstruction. If you have difficulty breathing when you're awake, then it's not likely sleep apnea, because sleep apnea only happens when you're asleep. I do have patients who notice that this happens when they're taking their afternoon nap on the couch. They're really relaxing, and then they start to hear this, even though they're a little bit more upright as well. And then apnea means no airflow, right? And so what are the different signs and symptoms of obstructive sleep apnea? Well, the first, within the name, observed apnea, someone tells you that you stop breathing. Snoring is also definitely up there. It's the low-hanging fruit, but also not everybody who has sleep apnea snores. So something to keep in mind. Choking or gasping upon awakening. So why does that happen? When the airway narrows or closes and your body doesn't get enough oxygen, guess what? Your brain says, hey, you gotta wake up and breathe. It'll tell you to breathe, wake up. Sometimes it's conscious, sometimes it's unconscious. The airway opens and then you fall back asleep and it narrows and closes. Difficulty maintaining sleep, right? Constantly waking up because your body wants to survive, it wants to have oxygen. And then unrefreshed sleep, right? If your brain is constantly telling you to wake up, you're going to be tired in the morning. Not everybody who has sleep apnea is tired, and it's really interesting. There's different severities of sleep apnea, mild, moderate, and severe. I have some patients who have very severe sleep apnea who are not tired, and I have some patients who have very mild sleep apnea and they aren't tired. And they're very tired. I'm sorry, I misspoke. So the severity of one's sleep apnea doesn't always correlate with their level of sleepiness. Morning headaches is something that we see pretty commonly, more oftentimes in women. Memory impairment, right? So going back to that glymphatic system, the shampoo, the trash collectors during the night, if you're not getting into your deep stages of sleep, your memory is going to be impaired. The things that you learn through the day does not go from your short-term memory into your long-term memory. If you don't get an adequate amount of rest, you're going to have a difficulty time concentrating. Urinating at night is also a big one. I like to talk to my patients about this because sometimes people are told that their prostate's enlarged, which certainly it can be, or they got to stop drinking water after 6 p.m. If I did that, I would definitely be really thirsty in the middle of the night, and that would wake me up. But guess what? If you have undiagnosed, untreated obstructive sleep apnea, that can lead to urinating at night. Why? Well, imagine your throat here, right, is narrowed, and what happens in the plumbing system in your house, right? Part of the the plumbing is blocked off, downstream, there's an increased amount of pressure. So when there's a narrowing of the upper airway, your lungs actually have to take deeper breaths to overcome that narrowing to help open up your airway. Increased pressure in your lungs puts more pressure in your heart. The top part of your heart, called the atria, actually stretches and signals down to your kidneys to tell you to wake up to urinate. I've had patients who wake up every hour. They stop drinking water at 6 p.m. They're on prostate medications. And once we get them diagnosed and treated for sleep apnea, that number really reduces. So not commonly asked about for patients and not even commonly thought about for some doctors. But if you do have difficulty urinating at night and you do have other symptoms of sleep apnea, would definitely encourage you to get tested. And then mood. When we don't get an adequate amount of sleep, our mood is sometimes one of the first things to go. A little aside here about gender bias in sleep medicine. So some of the research, as I mentioned, I really like talking about women's sleep. Women are often underdiagnosed with obstructive sleep apnea. Research that I read recently talked about 92 to 98% of women are still undiagnosed if they have sleep apnea. A woman who is tired, maybe overweight or obese, will go to their physician and get diagnosed with depression or get a lab slip for their thyroid, versus a man who's overweight or obese goes in to see their physician who has, fatigue and tired, will get a sleep test. So what are the sleep tests available to us? Well, there's twofold, right? Technology is quite amazing. We do have the ability to really study patients in the lab, at home versus the lab. The lab is a really excellent test, but you have to go overnight. Typically, it's in the hospital. There's a lot of wires there. And it may not be as comfortable to sleep in the lab versus at home. So the lab test is called a polysomnogram, and there's different types. There's a diagnostic test where you just sleep all night long. There's a split night test where we watch you for 2 hours and put you on treatment. And then CPAP titration test is a purely treatment. If you are a patient who has COPD and you already need oxygen or on oxygen at home, it is best to be studied in the lab to make sure that your oxygen levels are appropriately treated. Or, if you have obstructive sleep apnea, that's treated on top of having low oxygen levels, because it's a little bit different mechanism. Yeah, some of my patients who don't have underlying heart or lung disease, they can have low levels of oxygen because their tongue is choking them or blocking off the airway. So once we open up that airway, they may their oxygen levels improve. So not all folks with COPD, if they have obstructive sleep apnea, they may not need as much oxygen. Not to say that they don't, but going to the lab is a lot better to distinguish. And then there's a home test, and this is the test that I like to provide because I feel like patients sleep better in the comfort of their own home. The quality of sleep that you get is important. Sometimes patients say that the lab is too noisy or it's too cold. But really, this is the kit that I have. There's a nasal cannula that monitors your flow. The belt around your waist and chest monitors your lungs moving up and down. The wrist device will tell us if you're awake or asleep based on movement, and then the finger probe measures your oxygen and your heart rate. So one night is all we need. And if you have at least 5 events per hour, we have difficulty breathing, the mainstay, the gold standard of therapy for OSA is CPAP. So it's continuous positive airway pressure, or automatic CPAP, where we just set a range of pressure and the machine is smart enough to figure out how much pressure you need. There are different types of interfaces or cushions that just go underneath the nose like that are quite comfortable. There's other cushions that go over your nose and also with a hose on top of your head. But really all the machine is doing is this, right? So I'm sure you've seen these waving arm balloons, usually by the car dealership. What happens at night when you sleep, your muscles relax. And all we need to do is blow pressure in to keep it open. So the CPAP machine is just a fancy air compressor connected to a hose, connected to a mask that you wear on your face. Well, what about if I can't use a machine, if I'm claustrophobic? Well, there are definitely other treatment options. Mandibular advancement devices are probably the next option. What that does, it moves your lower jaw forward. Because your tongue is connected to this bone here. When the tongue is forward, there's more space in the back of your throat. There are surgical options. If you had a crooked nose, straightening it out. Sometimes removing the uvula and moving tonsils can help as well. So what about COPD? I know I talked a lot about sleep and OSA, but let's talk about the COPD syndrome called overlap syndrome. So there are specific symptoms that we see more often: more headaches in the morning, more tiredness, more daytime sleepiness, and shortness of breath with exertion. Right? These are seen more often in folks who have COPD and OSA as compared to OSA alone. One of the disconcerting facts of having overlap syndrome is that patients are at higher risk for hypertension or high blood pressure, even a higher risk of having a heart attack, higher risk of heart failure, and an increased risk for stroke, right? So increased morbidity if you have COPD plus obstructive sleep apnea, right? So having that obstructive sleep apnea, it's an upper airway obstruction. Really want to make sure that your body, your heart gets enough oxygen. How do you treat it? Well, it's really the same way. You open up the airway through the automatic CPAP or a CPAP machine. Sometimes people are on a bi-level machine, and that's just 2 levels of pressure. One pressure when you inhale, another pressure when you exhale. Some people need oxygen leaked into their mask when they sleep as well, but that's really something that an in-lab sleep study will tell you. Alrighty, so my top sleep tips, I always like to include this in my talk as well. And the number one is make sleep a priority. We know how important sleep is, or hopefully you know how important sleep is now. It's vital for overall health. It's good for our heart. It's good for our brain. It's good for metabolism. So make it a priority. Number 2 is give yourself the opportunity to sleep at least 7 hours. Typically, we have a wake-up alarm, but we don't always have a alarm or reminder to tell us that we should start getting ready for bed, that we should start the wind down process. Give yourself that opportunity to sleep at least 7 hours. 7 to 9 is ideal, but I would say for cardiovascular risk, having more than 6 has been shown to have benefit. Anything less than 6, then you should really take a look at your life and see what needs to be adjusted to improve that. And then the last, of course, since I'm a medical sleep doctor, is if you do have any underlying sleep conditions, such as obstructive sleep apnea or even insomnia. So insomnia is a condition where people have a hard time falling asleep or staying asleep. Have that addressed, right? Talk to your primary health care physician about it. Sometimes therapy can help if you have a lot of stress that's causing you difficulty sleeping. I know a lot of folks who have COPD can also have anxiety, not being able to breathe, feeling breathless can cause a lot of that. And so making sure that your anxiety is controlled, because that can also lead to improved sleep. Yeah. So this is my card. If you are interested in learning a little bit more about what I do, please visit my website. It's sleeplifemed.com. So my contact information is here. And wonderful. Thank you so much for joining me today and learning about sleep and obstructive sleep apnea as well as COPD. Take care.